Hi there, Dr. G here for another video for you. What therapy to do? What we talked about, how to choose a therapist, and what I thought was an important component in that decision process. But now you look at websites, you Google different types of therapy, and there are a lot. The last time I really dove into this was a few years ago, and I counted 168 types of therapy. I can't remember the website I found or whatnot, but there were 168 different types of therapies listed. That was several years ago, so I'm sure people created more since then. So it could be overwhelming, and a lot of the names of the therapies wouldn't be familiar to easily recognize it. I'll go through a couple of them that I'm looking at now. We got brain stimulation therapy. We got dialectical behavior therapy, equine assisted therapy, reality therapy. That sounds like a good one. We want to be in reality. Prolonged exposure, sand therapy. So you get to play in the sand. That sounds fun. Integrative therapy, mentalization-based therapy, schema therapy, Gestalt, hypnotherapy. I mean, the list goes on and on. And so how do we choose what's what there? Well, I have a big problem with this because the mental health field wants to really try and mimic the medical field as much as possible. When we talk about diagnosing the problem, obviously the medical profession diagnoses, and then what is the specific treatment for that problem? You go into the doctor and you have a broken knee, they run tests, they can diagnose, yep, you have a broken knee, here is this specific treatment for a broken knee. You're probably not going to get no more than one treatment to fix your broken knee. And so mental health field is really trying to streamline to just find that best therapy to fit that exact problem. I've worked in several places where basically that's the model is you have this diagnosis that equals this line of treatment, and go forward with it. Very almost robotic or mechanical. You score this number on the assessment, that equals this type of problem, this severity of problem, which equals this specific treatment. So when I'm hearing at minimum 168 different types of therapy, there's a big piece of me that says, well, you're not really knowing what the problem is. Because if we had an exact problem, we may have an exact answer for the problem. But now you have all these different therapies on how to attack or treat a specific problem. So that part of me is like, are you even knowing what the problem is? What's the fundamental problem that we're trying to treat? Another part of me says 168 therapies, there's a lot of overlap in all those therapies. And so let me create my own therapy. Let me do my thing. This is what works for me and my patients, and so I'm going to make my niche. I'm going to throw my name on a therapy. I'm going to write those books. I'm going to give those workbooks out, and my therapy is going to be the best therapy. You can see that if you ever dive deep into some of the therapies, there's some of them overlap way too much that I question why can you even name it something else when there are similarities there. When I hear over 168 therapies, I also think of, it's not a one size fits all. It's not this therapy works for everyone. And so we have to be creative. We have to find different ways of treatments to find what fits with a person in their situation. So that's kind of my concern here. A lot of these therapies, if you ever do research on them or whatnot, some of them don't even have like common sense. Like I think we're over analyzing, over complicating some things that again, I think it may be just because someone wanted to be different and, hey, I did this with this person and it worked, so let me keep doing it with other people. But I think some of them just don't even if you try and explain it to a person, it's like, well, that doesn't really make sense, or how can you really test that? So yeah, looking at what therapy does, what does it focus on, is a daunting task. Now, I think what you're seeing more of is focus on cognitive behavioral therapy. That seems to be what everybody's doing these days, and that's kind of a standard catch-all foundation of therapy these days. And the bottom line with that is that it's going to focus on your perception. How do you think about things? Do you think about things in a rational way or an irrational way? If you're rational, then there's a methodology to make you more rational. The behavior part of it is, do you behave in a rational way or an irrational way? Are you behaving in a way that's helpful to you or hurtful to you? And so we're going to try and change some of those behaviors to be more in line with a healthy way of living. So that's kind of the standard. You'll see CBT, cognitive behavioral therapy, you'll see on people's profiles, and that's how they do therapy. That's their model of approaching problems. I make a joke not too long ago. A new therapy, problem-solving therapy, came out. I'm not quite sure who invented that or whatnot, but problem-solving therapy. So in the year 2020, I think it was, maybe a little bit earlier than that. 2020, we're gonna develop a therapy called problem-solving therapy. Now, shouldn't that have been the very first therapy invented? What's your problem? Let's solve it. I don't know. But yeah, so you might want to stay away from therapies that are unique, maybe, or here's the latest and greatest type of thing. Well, really, latest and greatest? I mean, the human condition has not changed for thousands of years. I mean, we still experience the same things that people experienced 1,000 years ago. I mean, we still get depressed. We still get anxious about things. So now we just came up with the latest and greatest. That's it. This is the cure for everything. I mean, that's unrealistic. So, when you're looking for a type of therapy, I think it's good to maybe ask the therapist, as you're getting to know them, like what model of therapy is there one that you kind of ascribe to that you work with your patients, and have them describe it. Don't just say, "Oh, you do CBT, okay." Well, what does that mean? Help me understand what CBT means so that I can see if it makes sense to me, and if it fits with how I believe we go about addressing problems. So I think that's fair to ask that. But I think CBT is going to be your main one that you're going to see out there, and that's fine. But you can also ask your therapist what kind of therapy do you do? What does that look like? And then if it is reasonable to you, go forward with it. If it sounds crazy, or like, dang, I've never heard of this before, or whatever, then you know that's not going to be a good fit, and you should go elsewhere. That's all I have for you today. Thank you very much.